In the medical field, doctors have to be prepared for the routine and the irregular. That's why staff at Gundersen Lutheran Hospital in Crosse were busy this week sharpening their skills in case of a rare emergency situation. News 8's Pauline Lee joins us now live in the studio with a closer look at this scenario.
Well, the doctors we spoke to at Gundersen Lutheran Hospital have never had to treat a patient with a significant level of radiation contamination. But that doesn't mean it couldn't happen. Just 15 miles south of La Crosse, there is a retired nuclear power plant in Genoa. Even though the plant hasn't been operational for about 20 years, both the plant and hospital staff still need to be prepared, just in case.
I'm Dr. Crosse. I'm one of the emergency room doctors.
It's the challenge emergency room doctors face: how to treat patients quickly and safely.
Head injury, lost consciousness.
Isolated injury.
Isolated injury, all right.
But how do doctors treat patients with a problem they've rarely or sometimes have never seen before?
He is radioactive.
Cops and about a dozen other staff members at Gundersen are participating in a planned exercise to brush up on their skills in treating patients with radiation contamination.
It's a contact issue, so if you touch something that's contaminated, go do something else, come back and touch some other part of the patient, then you recontaminated the patient. So that's why the very regular checks with very sensitive radiologic detectors. And we'll take 4x4s and saline.
This radiation contamination training is required once a year, not only for hospital staff, but for those who work at Dairyland Power Cooperative. That's the company that owns the former nuclear power plant in Genoa. Gundersen's emergency manager says this type of training could come in handy for other rare events too.
In this day and age, we think, there's always the possibility of terrorism, and so to stay continuously ready, that's our mission.
So after cleaning and a thorough scan with the detector, this patient is ready to be wheeled into the main hospital for further treatment.
So he's clean, so you can help him down. I'm not, so I can't.
While most of the focus is kept on the patient's safety, doctors also have to remember to take care of themselves too.
Well, we're getting pretty good at this as we're going along, so it's always difficult to remember as far as getting the clothes on, taking the clothes off, the order, and it's just a matter of, because it's a contact issue, it's a matter of making sure that we're getting our potentially contaminated clothes off without contaminating our clean parts of our body.
Now, once the nuclear plant in Genoa is completely decommissioned, staff at Dairyland Power will no longer have to do this type of training. However, hospital staff will likely still continue theirs. There's another nuclear generator located in Red Wing, Minnesota. So, again, always good to be prepared, just in case.
Definitely. All right. Thanks a lot, Pauline. Now, planned exercises take place at Gundersen Lutheran once every few months. Staff train for not just radiation, but chemical and biological emergencies as well.